January is Cervical Cancer Awareness Month, and according to the American Cancer Society, nearly 14,000 new cases of invasive cervical cancer will be diagnosed this year. Dr. Gressel from Corewell Health specializes in gynecologic oncology and joins us now. Doctor, thank you for joining us.
Thank you for having me.
Give us a brief overview of what cervical cancer is.
Yeah, cervical cancer is one of the most difficult cancers that we treat, and I want everyone to be aware about this cancer because it disproportionately affects women of color, disproportionately affects young women with poor access to health care, and it's preventable. And so today I want to talk about HPV, which is the cause of the cervical cancer, screening for cervical cancer, and vaccination.
Well, let's start with HPV because there is a shot for that now, and some people choose to get it, some people don't. Tell us about that.
So the human papillomavirus is very common. It's a sexually transmitted virus, but it's not like HIV or chlamydia. It's much more common. Over 90% of people who have sex at some point in their life will get the human papillomavirus. And our immune systems usually get rid of the virus over time, like colds or flus or even COVID. But in some women, for reasons we don't understand, the virus sits around for a long period of time and causes the cells of the cervix to become abnormal. And so that's why we screen for human papillomavirus with pap smears and HPV testing. And you mentioned this Gardasil vaccine, which is 90% effective at preventing cervical cancer. So this is a curable cancer.
Yeah, so when you talk about the screening, I know that that has changed in the last several years from how frequently we need to be screened.
Yes. We used to screen women with pap smears every year when they come into their gynecologist's office. We now know that cervical cancer takes a longer time to develop, so we actually recommend screening for women ages 21 to 29 every 3 years with pap smears alone, and then from ages 30 to 65 with pap smears and HPV testing every 5 years.
Let's talk about symptoms. Are there any clues that your body is giving you if you start to have cervical cancer, those abnormal cells growing?
Most women actually will not have symptoms of cervical cancer, but concerning things would be changes in bleeding, abnormal bleeding that's different than what you would normally expect, vaginal discharge, pelvic pain with intercourse. Those are reasons to go see your gynecologist.
A lot of people will see their primary care physician every year. A lot of people won't, but some people will. You're encouraging women to go see your gynecologist on an annual basis too.
Yes, we recommend annual pelvic exams. Even if you're not getting pap smears, we recommend seeing your gynecologist on a regular basis for well woman care as well.
Yeah, Dr. Gressel, thank you so much for joining us with this important information.
Thank you for having me.